been slightly over a year since the COVID-19 pandemic struck, more than 2,000 people in the country have lost the battle to the virus, even as COVID-19 related fatalities continue to rise each passing day. Some families have been forced to bear the heavier brunt, having lost not one, not two, but three of their kin, either at a go or in quick succession, to the virus. Among the families is that of Lillyan Mutinda, the head of health promotion at the Nairobi Metropolitan Services, who in less than a week buried her mother and a cousin, both victims of COVID-19, while her two sisters battled harrowing experiences in isolation. David Mudhoka narrates.
At her house in Kahawa West, Kiambu County, Lillyan Mutinda, the head of health promotion at the Nairobi Metropolitan Services, is visibly in pain. The trained nurse is yet to come to terms with the drastic demise of her 84-year-old mother Alice Mutua, who succumbed to COVID-19 on March 13th after a 2-week-long battle with the virus. In tracing her late mother's footsteps, Lillyan tells us that her aunt's burial that was held in late February proved fatal to their family after various members who had attended the send-off, including her mother, 2 sisters and a cousin, contracted COVID-19.
My members of family and those who had gone for that burial quickly took into steps of isolating and going for tests. So the first test that my mom did was within 3 days after the burial, which was inconclusive.
While some of the members tested positive for the virus, her mother's test came out inconclusive. Meanwhile, that of her sister Naomi showed she did not have the virus. Even though the results did not raise any red flag, the two stayed put in isolation, just like the rest of the family members. Barely a week later, things took a turn for the worse when her mother, who has been living with hypertension, contracted a sore throat and a cough.
I arranged for them to get tested again on Wednesday, and they were both found to be positive.
It felt like the end of the world for Lillyan, who for the past 12 months has been on the front line in the fight against COVID-19. This time the virus had knocked at her door, threatening to snatch those she held dear. On 10th March, her mother, low on oxygen, and her sister Naomi were admitted to Mama Lucy Hospital. 3 days on, her mother began to show signs of recovery.
On Saturday, she managed to take a meal. She had asked for some meal from home, which I did, and she ate it heartedly.
But little did Lillyan know that would be her last meal. That evening, her mother breathed her last in the midst of her 2 daughters.
Despite being a medic, it was overwhelming. It was unbelievable.
Fast forward to Tuesday the following week, Lillyan led a handful of mourners in Yatta, Machakos County in burying her mother. Her 2 sisters, Naomi and Emily, who are now out of the woods, followed their mother's final journey virtually.
A relative was also being buried the same Saturday, who had also contracted COVID. So even to the larger family, it was a double blow.
She would not have imagined that her mother of all people will contract the virus, reminiscing how she had always held her guard up since COVID-19 broke out in the country last year.
We told my mom to be very restrictive and not to accept visitors coming into our homestead. We know up country how people are. You like visiting each other. And my mother would clearly tell people from the gate that they can talk from the gate, not to enter.
Lillyan wishes that perhaps the virus could have waited just a little bit longer before infecting her mother, who was on the verge of vaccination.
In fact, we had even planned that when she gets better, she could even be assessed and get, because we knew she was living with hypertension, and we didn't want to put her at any risk.
The news of the double blow have seen the family come face to face with stigma from a section of villagers in Kidhimani, Yatta. But according to Lillyan, instead of looking at the stigma glass as half empty, she sees it as half full.
In case any of them have COVID, they don't risk infecting you. And in case any of us have, then we shall also not infect anybody else.
Barely hours after two of Lillyan's kin were lowered to eternal rest, a somber mood engulfed Dr. Patricia Wawira's home in Bere, North Embu County, as the 47-year-old policy officer at the International Organization for Immigration and her mother, Catherine Njuki, were laid to rest after succumbing to COVID-19, also in a span of 2 days. David Mudhoka, TV 47.